Did you want to see me? Well, yeah, it's more would you say you're feeling any better than yesterday? Alright, then, thank you. Okay. Would you like anything really? You can have paracetamol, Maureen, are you feeling any better, worse, or the same? Are you feeling any better, worse, or the same? How would you say you're feeling? I do feel a bit better. Thank you. How are you feeling, Lydia? Any better, the same, or worse?
I feel kind of the same.
Okay.
I feel the same. I feel like I just am anxious because I'm worried about the fact that the painkillers are temporarily kind of putting a band-aid over a deep wound, which is this infection, and also I'm worried about the fact that I'm just I feel like the infection's kind of spread all along my organs, like both my it's like a urogynecological infection. So if you have an infection in one place, it's going to go to the other. So I'm quite worried about that because like I've had this for 2 years. I was first diagnosed with like the infection that's caused me to be here today. I was diagnosed with that in summer 2024.
Okay.
And like I've tried lots of different treatments, but the thing is because I'm not like to retest privately costs like minimum £100, and like when you're trying to cure like a complex infection, you need to be retesting every month. But I can't afford £100 every month, so I'm like relying on the tests we do at the NHS, and I don't know what tests they're doing. That's the problem. I don't know if they're doing tests. So, but I'm just really glad though that I'm getting the ultrasound scan, because that's good. I did speak to the nurse earlier about the fact that because my weight, I'm 94 kilograms, which is obese, and this Dr. Maloney put in his report that he thought that for people who have a BMI above 30, ultrasound scans just don't show up anything, because the radioactive wave, the radiology doesn't go through the fat, so it doesn't really show up anything, which is why the recommendation is for either a CT or an MRI rather than an ultrasound. So I'm just worried that, like, I can almost guarantee, to be honest, that I'll probably go in there and they'll say everything's fine, because they just won't be able to image the results, because, like, look at this, they're not going to be able to see through all of that. You know, because if you're doing an ultrasound scan on someone who's got a flat stomach, the radio waves can get through, but if you're doing it on someone, like, this is like clinical guidance, like I've got it in a report. If you're doing it on someone as big as me, you're just not going to be able to see the organs. So that's what I'm worried about, because the reason I'm emphasising this is because they're going to say to me, once I've done if I do this ultrasound, they're going to say to me, we can't do another scan because it's too much radiation. And I have been saying for 3 days, I'm like, I'd rather have an MRI or a CT, because then that's not going to, the obesity, which has an illness, which I'm suffering from, if I have the CT or the MRI, it won't impact it because of the strength of the radiation and the type of scan. But if I have this ultrasound scan, I already had one of those in January. I already had one at the Avenue in January. I had an ultrasound scan.
An MRI instead?
Yeah, I'd much prefer to have the MRI that I spoke to Dr. Paul about, and at least find out from him, because he said to me that he was going to put in a request for the MRI. And then they've come over and they've said you're having the ultrasound scan, but I'd much rather speak to the doctor about this before I go in for a scan and have that radiation, because once I've had that radiation, they can then use that as an excuse for not doing any further scanning.
I'll have a look if the MRI is booked or not on PPM, because it will show me.
Thank you. That would be great. Thank you. Hello.
Tea or coffee?
Could I have a coffee, please?
No sugar.
Oh, no sugar, thank you, just milk. Sorry, I'm just trying to put my eye drops in.
Mhm.
Thank you.
Any tea or coffee?
Coffee, please. No sugar.
Yeah. You're welcome. Sorry. Mhm. Any tea or coffee? Juice. Right. Not too weak, not too strong.
Did you manage to check the scanning board?
I can't see it on here. I have to go on the laptop on like a proper.
Oh, okay.
I'll let you know.
Thank you.
Would you like any paracetamol or coffee?
Desmond. Tea or coffee?
Excuse me, can I just quickly ask you something?
Yeah.
So basically, what I'm a bit worried about is that don't get me wrong, I'm grateful to have scans, healthcare, I know it's great, all great
Yeah.
stuff. Really grateful for all the healthcare I've received, really, really grateful. But I just wanted to state that I am a bit concerned because I'm 94 kilograms, which is obese, and that is a health condition in itself. And because I've been dealing with the symptoms of bladder inflammation for over a year, I went to Harley Street in London for a one-off appointment with a cystitis specialist at a cystitis clinic, specialist cystitis clinic called Dr. Malone. And he sent me lots of documents after the appointment, and one of the documents was all about cystitis, UTIs, the lines of treatment, etc. And it specifically said that when you're arranging sonography, when you're arranging radiology, when you're arranging scans to check the urothelium, which is like the bladder, the urethra, the kidneys and stuff, the urinary tract, it specifically says that if the patient has a BMI over 30, it is not recommended to do an ultrasound.
Okay.
It's not right. I could show you the document. I've emailed it to them already. They've got it on the system, but it literally says it is not recommended to do an ultrasound.
Yeah.
If the BMI is 30, it's not recommended because it will not show up anything.
Okay.
So it's recommended to do either a CT or an MRI would be the best one because they want this doctor Paul has said to me he would like to do a cystoscopy Dr. Kazam would like to do the cystoscopy, but they can't do it here because they don't have the
Okay.
facilities. And the next step down from a cystoscopy is this. It's got a specific term before it, but it's an MRI scan.
Yeah.
But what I'm worried about is that I've put in this request and I've spoken to Dr. Paul and he saw where I was coming from about the fat, because I've got a lot of fat and the waves are not going to get through that. And he said, I'll go and I'll think about it, or I'll make the referral and then we can see if they accept the MRI referral.
Yeah.
And then that was quite recently, and then another nurse has come over and said to me that I've got to stop eating because I'm booked in for the which you have to fast before a lot of these scans. And she
Yeah.
said I'm booked in for an ultrasound scan at 3, an abdominal ultrasound scan.
Yeah.
What I'm worried about is two things. The first is that they will, because they have the doctors have many times before say, we don't want to expose you to too much radiation. So once I've had this ultrasound scan, which I truly don't think is going to show up anything, because I already had an ultrasound scan in January
Yeah.
and it came back normal. I had an ultrasound at the Avenue, which was referred by my GP, of my kidneys and my bladder, and it came back normal because it's not getting through the fat.
Right.
And what I'm worried about is once I have this scan, A, they're going to say we don't want to expose you to more radiation, so we can't do the MRI scan. And B, it's not going to show up anything. It's not going to because I already have one in January.
Yeah.
So it's kind of like, I feel like the expense, as well as the radiation, as well as the kind of, I just think it would be much better to have the MRI scan.
Yeah. I can have a word with the medical team and see.
Yeah.
Honestly, I think that the amount of radiation you'd be exposed to with the 2 scans, I don't think it would be a problem because people
Okay.
have like multiple.
Do they?
It'll be fine.
Okay.
But you can have a word and find out.
Because if I thought that they were going to do this one, oh sorry, the last thing I wanted to say is that what I'm worried about is they're not going to see anything in this scan, and then they're going to say that's our reasoning to not do further scanning. Because like, you know, with urinalysis, they won't do further testing if it doesn't test positive for nitrites. But then what this cystitis specialist said is that the infection's in the lining of the urothelium,
Yeah.
so the urine will come back as clear. And that's what I'm worried about with this test, is that they'll say they've not seen anything, so they can't do further testing. Whereas if they just went straight in with the MRI scan, I'm almost certain that they
Yeah.
would see like inflammation somewhere in the urogynecological system.
Yeah. Well, I guess we'll see what they can see today, and if it isn't, they can't see anything, then the next step would be the MRI. scan
Yeah,
to see
that's
what they
true.
can
I mean, I
see.
just don't know how the system works, but I just would like to, if possible, if Dr. Paul is available to just come and tell me in person that the MRI scan has been rejected, because I sometimes think that like he might have gone off and be dealing with an emergency, and they're just trying to get me they're trying to get free up the bed, so they've just, you know, reasonably so, but then they've kind of fast tracked me for the ultrasound without the consultant in charge of the plan even being informed. Sometimes that
Yeah.
happens. I know my brother works as a physio in London NHS, so I was just wondering if it would be possible to just make sure that ideally speak to him. If he's too busy, then at least make sure that he's like, he knows
Yeah.
and has approved, and like that he's heard back from the MRI team about whether they've accepted the referral.
Yeah, I'll go and find. I'll ask them to. I'll pass the message along and come
Thank
back to
you.
you with more
Thank
information.
you, thank you.
Yeah, I know you've I've mentioned this about the ultrasound before.
Yeah.
We've had a discussion. Well, I haven't had a discussion about it, but it's been in the notes before.
Okay.
Don't worry, we're doing it as like a sort of cover-all issue,
Okay.
basically. So if we request an MRI, they'll say, why haven't you done an ultrasound first, basically.
Okay.
So it's just there to say, look, we've done it, we've tried to get some good imaging,
Yeah.
and we've tried to do it without
Okay.
as cost effective as possible, basically.
Yeah.
It won't delay an MRI because MRIs don't happen the same day anyway.
Oh, I
We're
see.
putting the
Okay.
request in for the MRI anyways, but it's best to just have the ultrasound first,
Yeah,
so
I
that they
understand.
can see we've
I
tried
understand. The only reason the
Yeah.
reasons I'm mentioning it is
it. Yeah.
a few things. The first is that I don't know if you're aware, I don't know if you have access to my medical records or have been told, because I haven't even been to my new GP yet. But I already had a kidney and bladder ultrasound
Ultrasound, yeah.
at the Avenue
Yeah.
in Alwoodley in like January of this year.
Yeah, that's.
It was a while ago, yeah, but it
didn't.
didn't. It all it showed up was a residual volume of 60 milliliters.
Fine.
But the second thing is that because I went to see a doctor on Harley Street, just a
Yeah.
one-off appointment because I was so desperate,
Yeah.
he basically sent me that was what that came
We've
out
got
that. But
the
he
document,
yeah he sent me but the main thing, he sent me this document and he said that and he's a cystitis specialist. And
Yeah.
It's a cystitis specialist clinic.
Yeah.
So it's like very much they know about bladder infections. That's their area of their bread and
Yeah.
butter. And he said that for those patients who have a BMI of over 30, it's not recommended. It's in the report I sent you. It's not recommended to do an ultrasound because of the fact that it won't show up anything because of all this fat. It won't show up anything. But I totally understand what you're saying about it, procedure and like you're just not procedure but like due process. It's just like this is the first step and then you do after that.
Yeah.
But the two things I said to the nurse about why I was worried about having it, which she's reassured me isn't the case, is A, that if I had the radiation once, they may then say we can't do the MRI or we can't do the CT because it's too much radiation.
Yeah.
And the second thing is that they may use the fact that they don't see anything in this ultrasound because of the fat as reason not to do further testing.
And I completely understand that concern, but usually it supports us in getting a further investigation because ultrasound in certain cases isn't as sensitive. CT and MRI are more sensitive.
Yeah.
MRI is better for soft tissue anyway.
Yeah.
The terms of the fatty tissue again, due process as you're aware, it's fine. If they can't see anything, we'll move on to the next step. We've already got the request in place.
Okay.
It won't stop anything. Not
Yeah.
to
I mean, you
worry.
never know. They might see something.
Yeah.
I don't think I had the
yeah.
abdominal one. I had
Yeah.
a specific. It was
Yeah.
only the kidneys and the rest. They might
Exactly,
see something.
yeah.
I mean, I don't know, but I just want to make sure that I've like
definitely said what you needed
said
to say.
what I needed to say.
Yeah, exactly.
Just in case, just to cover my bases.
Yeah,
just in
100%.
case,
And we're here when we do ultrasound KUBs. They don't scan anything else. They just ignore the rest of the abdomen.
Yeah,
So,
yeah.
because for ultrasound KUBs, you don't need to be fasted. For ultrasound abdomen, you need to be fasted. So that's
Oh,
why.
okay, yeah.
So that's
yeah.
what the difference is. So
That makes sense.
it will
I'm not going to
help
eat
us.
anything else.
Yeah, perfect. I was like, oh, it's
Yeah.
only been a forkful. It's fine. So yeah.
No, it's good you told me that because
Yeah.
I went for an ultrasound scan
Yeah.
the year before last or last year here in St
Mhm.
James's, and it was an ultrasound. It was mainly to scan what was supposed to be my spleen and my pancreas.
Yeah.
It might be abdominal, I'm not sure, but it was just mainly scan the spleen and pancreas. And I read up what they'd written. They said we found cysts, very small cysts on the spleen, but they couldn't actually scan the pancreas because it was obscured by gas.
Yeah, exactly.
The reason it was obscured by gas is because I had eaten that morning.
Yeah.
Because I can't eat.
Yeah.
Why I'm obese, I really seriously have
Yeah,
like a
well,
binge
they've
eating
booked
problem.
you in for late afternoon anyway, so like
Yeah.
4:30ish, because I said you've had breakfast, or you might have had breakfast already by the time
Yeah.
I put the request in, because you need to do a separate request to add it on basically.
Oh,
So that's
okay.
why, because
Yeah.
we're only going to scan the kidneys. So that's why
Okay.
we're doing it essentially, but
Yeah.
hopefully that's reassuring.
Oh, are they scanning the
You
kidneys?
scan kidneys and the
Oh, that's good.
liver as well, so it's both.
Oh, in the liver. Yeah, because when I looked up the I've been looking at like all these different
ALT,
tests, and I looked
yeah.
at ALT on quite a lot of different websites and stuff, and it said like it could be a sign of hypertension or diabetes, but it
Yeah.
also could be like liver not
Anything.
working properly, and that can be due to like
Genuinely.
vigorous exercise, or it can range to being like liver disease or
It can be
Yeah.
anything. Like ALT is so sensitive.
yeah.
It can shoot up to like 300 and something just when you have a slight drop in your blood pressure. It's ridiculous. It's very
Yeah.
sensitive.
Yeah.
But usually it just normalizes pretty quickly as well. So if we repeat
Yeah.
the blood test in 2
Maybe need
days,
to repeat the blood
Yeah.
test. Yeah.
So I think tomorrow, if we
Yeah.
repeated those blood
Yeah,
tests,
for sure.
I'd bet it would be better. If it's not, it could be associated with medications. I think you take a
Yeah.
olanzapine, is that correct?
I don't anymore. I
Not
haven't taken
anymore.
that for years,
So,
but I
yeah.
must say I have taken a lot of antibiotics
Yeah.
recently.
Antibiotics.
Ciprofloxacin,
Yeah.
coamoxiclav, metronidazole,
They all affect ALT.
trimethoprim. Now it's then it was cephalexin a couple of days
Yeah.
ago. Now it's pivmethylin, so that could have affected
All
the
of them
ALT.
get processed in the liver, every
Yeah,
single one.
yeah,
So,
it could
so
be
they,
that.
it does make it go up a bit. Yeah, antibiotics can routinely make it go up. Antipsychotics and things like that also do the
Yeah,
same.
yeah.
Olanzapine's more dramatic with the rise that it
Yeah,
gives you, so we
it's a
monitor
heavy
that when you
duty
start it.
one.
So yeah, it could
I've
genuinely
also
be
got
anything.
proteinuria, and I must
Yeah.
say, just based on like, I used to go to like
Yeah.
family planning clinics a lot, and
Mhm.
it always does seem to come up for a really long time, and I know I think it's trace amounts,
Mm.
but it always does come up for proteinuria,
Yeah.
and I don't know what that would be a sign of, but I think it's related to the kidneys.
Kidneys, yeah. So it's sometimes if you just have like chronic infections, it can make
Mm.
protein go up as well as the
Yeah.
other inflammatory markers. If you have
Yeah.
stones, you can get protein in the urine.
Yeah.
It's just another sensitive thing.
Mm.
Filtering of your kidneys might not be so great, but we can tell by
Yeah.
your kidney function on the blood test if the filtering isn't great, and sometimes that
Yeah.
can let proteins through. If you have high blood pressure, that can also cause proteins to come out
What
in the
about?
urine.
Can I just ask about? Because I've been doing a lot of reading. What is it about the creatinine albumin ratio?
Albumin.
Because I keep hearing that
Oh.
term come up.
Albumin creatinine ratio.
Yeah.
You're taking me back to my textbooks.
Right,
In
yeah.
all honesty, I cannot off the top of my head remember.
Really?
I'd
Yeah.
have to go and look. It's one
I
of
was
those
trying
things
to
that
make
you need
sense
to
of
do.
it, and I was like, but I'm quite intelligent,
Yeah.
but like this
It's
stuff
just
just
not-
is beyond it.
To be honest, on my my last 2 jobs ago, when
Yeah.
I was on medicine, we used to do it for patients a lot, and so I got the hang of it. But it's one of the
Yeah.
things you need to get into the swing of recognizing
Yeah.
the patterns of results.
Yeah, for
But,
sure.
Yeah, it's
Yeah.
completely out there now.
Yeah,
But yeah,
creatinine and all this stuff. Like I'd have to get a textbook and
yeah,
really study it to
definitely.
understand
It's
all
just
of
one
that.
of them. Yeah, the ratios they get confusing. The standalone
Yeah.
blood results are so much easier to understand. But yeah, the ratios.
yeah.
The ratios
yeah.
help you understand them. In
Have you had a
relation
look
to
at my
them.
blood results?
I had not personally, not me
You haven't?
personally.
Okay.
So
Yeah,
I
okay.
know that the ALT was 58, I believe, and
Yeah.
I put in the request for the ultrasound, but I'm on electives, I'm not on acute, so I'm just lending a helping hand.
Oh,
So I don't know
okay,
you
yeah.
personally, but
Okay,
I just
yeah.
know of you because I was requesting your scans.
Yeah.
I had to give them a helping hand.
Just to let you know one last thing, just informing you because I know
Mhm.
some of those things get lost.
Mhm.
When I arrived at the assessment ward,
Mhm.
wherever that is, upstairs or downstairs, when I arrived at the assessment ward, I spent a night there.
Mhm.
And on the day I arrived, I was told to do blood tests, urine samples, and
Yes.
then give fecal swabs,
Yep.
samples. And I didn't open my bowels for a whole 24
Okay.
hours. So then I did, and I gave them into reception.
Mhm.
I'm presuming no news is good news.
No news
But,
is definitely good news. Yeah.
I just wanted to say
I'll-
it again because I think I've
I'll
only
check.
told one person that I haven't had any news about those swabs.
Let me have
About
a look.
those, sorry, not swabs, about those samples that I
I'll
gave
check
them. Yeah.
because it would have been checked for like an infection. I'm going to
Yeah.
check now. I'll check now.
Okay, thank you. Yeah.
Did you have any change in bowel habits? Or any issues with the bowels? Or was it they just doing a coverall?
I think the reason they did them is because before I arrived at the hospital, I was suffering from quite bad, like diarrhea.
Diary, fine.
Yeah,
Is
and
it settled?
yeah, it has settled. I think codeine kind of causes the opposite, so it
Yeah,
has settled. I
fine.
wouldn't say the only thing I am worried about is I because of that pancreas scan where they couldn't see the pancreas because of the build-up of the gas. I have a really bad problem with that. Really bad problem with like distension and bloating and like gas build-up.
Okay.
It's very chronic. Like
Yeah.
it's kind of like
Fine.
really quite painful at some points.
Fine.
But I think that was probably why they ordered
This the
the-
stool sample.
the stool samples. Yeah.
It's not on the request and it's not in progress, so I have a feeling
Okay.
it's not been sent. Since
Okay.
things have settled,
Yeah.
we'll just keep an eye on it.
Yeah,
And,
that's fine.
yeah,
I think the
leave it.
request would have been from what do they call it? The assessment
Assessment unit, yeah. So
unit,
I've
yeah.
looked and I've gone back to February of this year. There's
Oh,
no
really?
stool sample request since
Oh, okay.
February. So
Okay.
I'm assuming they just
Yeah.
asked for it, but they didn't request it,
Yeah,
and it's fine. But
Yeah.
if it's settled now, it's
Yeah.
settled.
yeah,
we'll
it's
leave
settled.
it be.
It's not something I'm not worried about.
There's
So.
bigger fish to fry. at the
Yeah, there are
moment.
bigger
Yeah.
fish to fry,
Okay.
100%, in terms of getting this infection or whatever it
Yeah.
is that's causing these issues sorted.
Fine. All right.
Yeah, I just wanted to ask, just because of, just for reference,
Mhm.
does this ward have like an email address?
Oh, you'd have to ask the ward clerk at front
Oh,
desk.
okay. Yeah.
That would be really
Yeah.
helpful if I knew if we had one, because I could just see.
Basically, you're a woman actually, so this
Yeah.
is important. You're probably the best person to speak to about this. So today, I received an email from a scientific director called Nick Parkinson. I'm not like a high-flying person or anything, but I have paid like £600 plus for like private medical tests this year because
Okay.
of the symptoms were so bad. And he's from a company called Digital Microbiology.
Okay.
And basically, I just did it's a home test company. I did the home
Nice.
test, sent it off to him, came back with Enterococcus, Peptonophilus, and Gardnerella. Gardnerella was 180,000 CFUs. Enterococcus was about 10,600, and
Right.
Peptonophilus was. They said ignore the Peptonophilus because although it's above the threshold of 10,000 CFUs, we're not worried about that.
Fine.
But what Nick Parkinson has emailed me today, because I just asked for some advice, because
Right.
usually they don't get back to you, but he does.
Yeah.
They're a good company, they get good reviews. And he's basically said, I'd really advise you to focus on targeting the Enterococcus because
Fine.
that's most likely what's causing your
Causing
symptoms.
it, yeah.
But then he said, which was interesting because I hadn't really thought about this. He said he thought that I had a really bad vaginal infection, which is what the Gardnerella is, and the Gardnerella is
Yeah.
not causing the symptoms of the UTI because
Yeah.
it's in the urinary tract, but it's a sign that it may be spilling. The terminology he used was that bacteria may be spilling over from
Right.
the birth canal to
Fine.
the urinary tract,
Okay.
and then kind of moving upwards and causing the
I did
infection.
see on your notes there, looking for a gynae opinion. So I think
Yeah.
they'll be trying to get in touch with the
So that's
gynae
why
team
I just
today.
asked. I couldn't remember. I've got that
Yeah.
short-term memory problems. I couldn't remember. But that's why I just asked you for the
Yeah.
email because I was going to send that email from him
Yeah.
onto the system.
Yeah.
I might not need to because I've told you and
Yeah.
I've told Dr. Evans.
I
But
would just ask the ward clerk
Yeah.
and say, can I give you this email to attach? And I'm sure she'll be more than happy to do
I
it.
will.
It makes
I
it
will
easier
ask
to
her.
have the documentation there.
Yeah, I will
rather
ask
than
her.
passing on notes because day
Yeah.
to day they get lost essentially.
Yeah.
Like somebody might not just check one note and that's it. It's gone. That information's gone. So
Yeah.
I'd recommend telling the ward
Because it
clerk.
would just be a shame if they managed to treat this infection in
And then
the
it came back.
get it all clear, and then because
Yeah.
the original infection hasn't been treated, it's always
Yeah.
going to keep spilling over.
Yeah, I'd definitely recommend
So
speaking to
has
the ward clerk.
when you say there's a note on the system about the gynecologist,
opinion.
have they been
So that's on the jobs
consulted?
list. So we're
Oh,
waiting to
okay.
hear back from them. We're trying to get everything.
Okay,
organised
that makes
quickly.
sense. Yeah,
So that's
I'm sure once they look at all the documents and then
Yeah.
the tests you've done here, they'll probably immediately know.
And to be honest, the sooner that's on the system, it'd probably be helpful. for
Should I
them
go
to
and
see
do
it.
that now?
Yeah,
Should I go
think
and
so.
ask?
I think
I'll
that's a
ask
good
the
idea.
clerk for it now.
Yeah.
Yeah.
No problem.
Yeah, that's true. Excuse me, are you the ward clerk? Are you the ward clerk? advised by this doctor who is, I'm not good at remembering names, but whoever the doctor is with the headscarf, she said this doctor.
So she's got an email from another. So you had one from Harley Street, and they managed to upload the document to their PPM. She's got another email from a different doctor as well. You could upload that to PPM. That'd be great. I know you're not the ward club, but
It's a
do we have a
clinical
ward
thing.
email?
Yeah. Let's give them a clinical thing.
She's gone on break.
She's gone on break. Fine. As soon as she's back,
Okay.
she'll be sat there. She's
I'll
in
come
a
and
black
ask.
shirt.
Yeah, thank you.
No problem.